And welcome back to the show. Now, I've never really heard anyone complain about going to a doctor too soon. I mean, who's ever said, I should have waited another year for that checkup? Well, if you're noticing changes in your hearing, you should never wait to schedule an appointment to get it checked. This morning, we're happy to have with us Dr. Carolyn Yates from Hearing Evaluation Services of Buffalo. Thanks for, and she's making a house call on the Saturday, so be sure to thank her so you don't have to wait for it. Dr. Yates, great to have you here. You are a certified tinnitus specialist, and this is Tinnitus Awareness Month, which I did not know.
Yep.
And people are saying, what's tinnitus? It's tinnitus. You can pronounce it that way. It's also pronounced tinnitus. Tell us what it is and what are the symptoms?
Yeah, so tinnitus we describe as like the sound in one or both of your ears or in your head when there's no external sound source present. So we often describe it as like a phantom perception of sound because there's no real physical sound wave that's creating that sound. It's your brain creating that sensation. So a lot of times patients will describe that as like ringing, buzzing, hissing, but it could really be any sound or combination of sound except voices would be considered tinnitus.
And probably everybody watching has experienced, and I'm thinking it's tinnitus, ringing after a concert.
Yep.
Maybe the next day.
Yep. Yeah, those are normal. Sometimes you can just have little slight bursts of tinnitus that last a few seconds and then go away. For some patients, that's there 24/7 for them. So it can be different for everyone.
Now, those people who have it 24/7 probably think, it is what it is, I have to live with. Not the case, is it?
No, that's probably the biggest misconception about tinnitus. There's nothing you can really do about it. A lot of patients come to us having been told like they just have to live with it, and that's just really not the case. There are a lot of research-backed approaches that are out there to help patients really effectively manage their tinnitus long term.
Can we prevent it? Is there things we can do? I mentioned concerts. Is there things we can do to limit our chances?
Yeah, I mean, the biggest thing you could probably do if you're is protect your hearing when you're in those noisier situations, like you mentioned, like a concert, or when you're mowing the lawn, or, doing something that's really loud, shooting, things like that. But protecting your hearing, things like that, that's really important.
All right, well, let's say, again, we didn't, and we're dealing with tinnitus. What treatments are available?
Yeah, so there's a variety of different options that are available, and it really is individualized by everyone's needs, what you come to us with. So sometimes patients just need a little bit of counseling and better understanding. We use sound enrichment options. Sometimes we use hearing devices because there's a huge correlation between tinnitus and hearing loss. And then we also have other tools like the linear device that are available.
Yeah, I was going to ask you about linear. Tell me what this is all about.
So linear is a newer option that we have in our toolbox to help patients with tinnitus, and it uses this concept called bimodal neuromodulation or dual mode stimulation. So what that means is we're stimulating two nerves at the same time to help retrain the brain to become less sensitive to the tinnitus. So linear uses auditory stimulation through using headphones and then just applies a light electrical impulse to your tongue. And what this does is it drives the brain's plasticity to retrain itself to be less sensitive to the tinnitus. So it's a pretty structured program. Patients use this in the comfort of their own home about an hour a day over an initial 12-week period. We see that patient for a few visits during that time. And what it does over that period, patients notice a clinically significant reduction in their tinnitus. And about 90% of our patients said they would actually recommend linear to somebody else.
All right, that's a great option that's available. And your beats don't work with that. That's why you got to go to Hearing Evaluation Services of Buffalo to get the proper equipment and the evaluation. If you haven't done so, go see Dr. Yates and the staff there. Because if you're noticing changes in your hearing, time to schedule. It's a no obligation hearing evaluation, by the way, with the wonderful doctors at Hearing Evaluation Services of Buffalo. They have 4 office locations across Western New York. You can find them in Amherst, Williamsville, Orchard Park, and Tonawanda. Hey, to find out more about all the hearing services they offer, their website is hesofbuffalo.org, or you can give them a call, the number you see on the screen, that 833-4488.